Okay, Ignite. This is the latest device for 2024, so Optimus Max with all the newbies. The newbies on Optimus Max are the new IPL. More efficient, the hair that's on there, a new big forma. We kind of went over all that stuff. And now for the Ignite. The Ignite is brand new for 2024. And this is the device that Andrea uses a lot. And so it's one of my favorite lectures to give. Just know we just received FDA approval, maybe 2 months ago. I'm a little lost on time. So the point of the matter is, I don't think there's very few people in the country that actually have hand pieces. So I've been using this for about 3 or 4 months now. We've had it for a little longer, but because of the FDA, I had to get closer to approval. So when it comes to pictures, we have early pictures, but I'm excited to show you because they're pretty awesome. So on the Ignite, we've got a bunch of opportunities, and think of this, they call it surgical. None of this is surgery. You're like, oh, this is a surgical device. None of this is surgery. All of this is done in the office, under local, maybe local tumescent, with or without some PO meds. So none of this is surgical, it's all procedural. So they wrongly call this the surgical device. There's no surgery. This is all done in my office, not in the surgery center, in a side room, under a semi-sterile technique, under local. So all of these are procedural in nature, but they are on our scale, the other end of the scale. So we started in the shallow end, now we're jumping into the deep end. This is your most extreme version or forms of body contouring that we're gonna walk through today. And so we all know that in this space, it's skyrocketing. All of my patients, as a surgeon, all of my patients desire a bikini body without surgery. Now, that expectation isn't always realistic, but boy, we're sure getting closer and closer and closer as the years go on. No one wants incisions, no one wants downtime, but they all want the maximal result achievable. So that's what this is, body tight, face tight, acutight, and then the quantums. We're using radiofrequency. Sometimes we couple it with liposuction to create extreme levels of, or I should say varying levels of body contouring. They can be extreme, we'll show you pictures. So bipolar nature, in my body tight, this is the most aggressive piece of equipment that I have from InMode, but it's still under local tumescent. In the office, semi-sterile procedure, I fill up the soft tissue envelope with tumescent solution, and I apply the treatment. It's bipolar nature, so the radiofrequency comes from the inside up to the external electrode, and everything in between gets treated with radiofrequency. You, as the providers, get to determine our cutoff temperatures, both internal and external. This keeps our patients safe. This also allows me to get to my temperature every time. I know that the fibroblasts get kicked off. It's like a light switch. It's all on, all off. At about, internally, somewhere around 68 degrees Celsius. Some literature might show 65, so call it north of 65. A fibroblast gets kicked off to do what it does, repair collagen, remodel collagen, lay down new collagen. And we also, when we get this heat, we get dermal tightening. So you and I choose our endpoint temperatures. That's based on the patient's goals and the exam. And then we determine, hey, externally, I want to get to 40 degrees Celsius. Internally, it can handle more heat because you're not worrying about burning the external surface. So internally, let's get to 70. You select that, and then you step on a pedal, you apply this treatment, and the machine does the rest. You will get up to that temperature. When you get to that temperature, energy gets cut off, keeping my patients safe. Unlike the old laser lipo days, which I used back in fellowship. We used smart lipo, laser liposellulase. Temperature regulation, temperature control was very challenging. It didn't have internal temperature monitoring, let alone would shut itself off like Body Tight does. So there's thermistors in here, thermal measuring mechanisms, internally and externally. And these thermistors measure 1,000 times per second my temperature, which I set. And a couple of things that happens with those thermistors, we've already explained some of them, but the rate of rise. So as the temperature increases, if the machine senses it's increasing too quick, and I can't remember what the unit is off the top of my head, it's a certain degree Celsius per millisecond. If it doesn't like it, if it's raising too quickly, shuts off. It's called a temperature surge. It's an ugly little sound on your machine, and you'll see the word temperature surge. It means too hot, too quick. You're either too close to the dermis, and this is where the training comes in. We've got a lot of ways to get you trained. I've got an institute that I partner with InMode. A ton of you come down. to Arkansas. There's some graduates here, actually. And so you come down and we'll teach you all this stuff. But if you're getting temperature surges, you're either too close to the dermis internally, you're lightening it up too quick, or you're under tumescent. You just need to add more tumescent solution to insulate the area quicker. It's too dry. Maximal temp, that's another safety thing. You and me determine the temperature that we're getting up to, internally and externally. And then coupling. So these are the built-in safety mechanisms in this handpiece. Coupling means I've got an internal electrode and an external electrode. If those aren't matched up, meaning if the inside, if I get hung up on some FSN, that can create a tissue arc, just like our friend here asked me about the forma being flat. I can create a tissue arc, which can turn into a thermal injury. So if the machine, it's got an impedance sensor, meaning am I receiving my radio frequency? So it comes from positive, goes to negative. So on the negative, it's like, am I receiving my radio frequency? If it doesn't sense that it's receiving the charge, guess what happens to the energy? Shuts itself off, so we don't create a tissue arc. Very, 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 very safe.